Hello everyone, I'm Glory, Chidimaren analyst. This is antenatal class, and I'm beginning this class with physical changes in a pregnancy. So for you to be able to have a healthy pregnancy journey and have a successful childbirth, you have to know the reason why many things have changed in your body system. And that's why we are beginning with the physical changes that occur in your body as a woman that is pregnant. So, let's go. The most obvious one that usually occurs among about 90% of pregnant women is what is called hyperpigmentation. And what is hyperpigmentation is like there are more deposits of melanin on your skin, that is your dermis and your epidermis. So on your skin, it becomes darker, but it's more obvious on those that are dark before. So you see someone being darker than before. It's not something, or you are pregnant, you are not becoming darker than before. It's not something that should worry you. It's the hormonal changes that result of hyperpigmentation, and that is why you are having the melanin deposits. Some will be on the face, known as chloasma. So there will be just this dark coloration on your face. It's something that will go off after the childbirth. So the next one is blood volume. The volume of your blood will increase. Why is it increasing? So that there will be more perfusion of blood or more supply of blood to the placenta. And what is placenta? Placenta is like a place where your baby feeds on. So that is it. Another thing is that hemoglobin. Hemoglobin, what is hemoglobin? It's oxygen carrier. It is inside the blood. It carries your oxygen and it is reduced. And that's why some women are always anemic. They have anemia during pregnancy. And because of that, you need to work on your diet, increase more on vegetables, and don't take your hermetinics for granted. Make sure you take it as prescribed, because that's the reason why your blood level, your hemoglobin is coming down. So you need to boost it up with your medication. In so many cases, diet is not just enough. That's why so many mothers, pregnant women, are put on hermetinics. Another change is airway. You see, some people may be having some congestion. Usually, the whole of the body is increasing. The same way your airway have a way to increase. So there are kind of edema in your airway, swollen. So because of that, you feel that you are congested. And that's why you see a pregnant woman in anywhere, you always encourage the person to sit beside the window or the door or close to the fan for easier ventilation, because they have their airway seems to be more constricted. So it's not your problem. It is how your body is designing to adjust to the pregnancy level it is. So another changes is the one that occurs in your GIT. That's mainly your gut, your intestine. So many times it results of constipation. Or the two things causes it. The hormone have a way of reducing the way your intestine moves. That is removing it affects the way your intestine empties its contents. It slows it, seconded by the uterus, which have a kind of physical pressure on it. And if you are the person that always go to toilet maybe every blessed day, I say you are pregnant, you hardly go to toilet maybe once in 3 days or in 2 days. It's nothing to be worried about. What you just do is increase your fluid intake, and your vegetables, just increase it more, and that's all, and you'll be fine. The next other thing that's very, very important I want to talk about is there are some changes that occur in your kidney. So that changes that occur in your kidney is something that you have to work more on. Two things are causing it. Like I said before, two things basically affect your urinary tract. So the first one is the hormone. It's relaxing. Pregnancy hormone have a way of relaxing your muscles and tissues. And the presence, if you know the position of your womb and that of your a woman urinary system is close. They are very close. So as your baby is growing, is impinging, is lying on the tube that should be emptying the urine from the kidney, and it will, like when it kinks, even if you want to use the toilet or use your restroom, you will not 100% empty the old tubes. There are some urine that will be left behind. In some cases, they call that a stasis. And this urine, when it's being left behind, is have a way of attracting microorganisms. And in this case, so many pregnant women are at risk for urinary tract infection. And that's why they have to be very careful and more careful with their hygiene in that area. So next one is a lot of men will say, "Why am I eating so much? I don't have appetite before being pregnant. Now I have appetite." There's a reason for it. For it, because your body system needs more nutrients. It needs more energy for you to be able to provide for the growing fetus. So that's why the body is adjusting for you to, it requires more energy and it requires more nutrients. That's why in this case, you always, no matter how you crave, no matter how your body demands it, channel your appetite or channel your food desire to balanced diet. So all these things that I've said before and I've said now have a way of enlightening you on how you go about this pregnancy journey, so that it will be an uneventful one, and it will be such that will end in a very great and successful way. So that is the essence of going through these changes. When you have idea of why something is happening, why something is behaving in such a way, or the reason behind different actions of different changes, you have a better way of making a well-informed decision concerning anything that will come up on this journey. Okay, this is the end of this very class. So we'll pick up next topic next time. Thank you. So if you found this very informative or it added any value to you, please kindly like, share, and follow so that others will be enlightened as we are.